everybody. It's great to see you all today. As Mary's introduced me, I'm Libby and I'm the Projects and Communications Officer here at Finecure. Today I'm going to talk about tools and tips for online communications. So if you're a new patient group and you're not already online, sharing ways that you can sort of get online. And if you are already quite advanced in your communications, hopefully giving you a couple of tips to make it more effective and a bit easier. There's a real mix of people in the room today, so I'm going to keep it relatively basic, but hopefully everyone will pick up at least one new thing to take away from my session. And if it does go completely swoosh over your head, please do ask me questions at the end, or come and grab me. I'll be around the whole day, and I have got my laptop with me as well, so I can, if there's something you want me to show you, I can show you when I do particular things as well. Great, so in terms of content today, I'm going to be going over the what, why, when and how of social media, websites and e-newsletters. So, social media. Social media can be defined as forms of electronic communication through which users create online communities to share information, ideas, personal messages and other content. It's a form of social networking in which users build virtual networks online. There are a number of platforms that you can use to share this content in different ways and for different purposes. Platforms are popping up here, there and everywhere. But for smaller organisations such as yourselves, you're better off sticking to the core kind of ones. And the three that I'm going to go through over today are Facebook, Twitter and Instagram. Yeah, so I'm going to go over the audiences and purposes of each, so you can decide which is right for you. You might decide that Facebook alone captures all of your needs and you can absolutely nail it, and that will do you, but it's good to consider other options as well. So, why is social media important? Firstly, it's really, really popular. Facebook alone has 2.2 billion monthly active users. So there's a real large volume of people that you can kind of connect with through social media. Secondly, you can reach multiple audiences at the same time. Anyone can follow you through social media, regardless of why they're interested in you. It might be patients, families, doctors, researchers and so on, and you can communicate to them all at the same time, so it's quite an effective way of communicating. Thirdly, as Mary Rose mentioned, visibility. If you're for a rare condition, you want patients, families and so on to be able to find you. If they've just got a diagnosis, it's another way that they can try and find you and connect with the wider community. And fourthly is engagement. It's a really good way to keep your followers up to date. It's unlikely that other than your core group of supporters, people won't keep checking back to your website to check for updates. You can keep them updated through social media and also help spread the word to new followers as well. Great, so now I'm going to go through the three main platforms, starting with Facebook. So Facebook is the most popular social network. There are 44 million monthly active users in the UK, which is about 67% of the population. A huge proportion of everyone in the UK is on Facebook, and also 2.2 billion users worldwide. It covers a really large demographic range, so as you can see in this graph here, there's a significant usership across all age groups, and it's very much a global platform as well. You might be surprised to know that India actually has the highest number of users, followed by the US, and the UK is 10th behind Brazil, Indonesia, Thailand and others. So you can try and really sort of tap into that global network, particularly important for a rare condition where everyone's geographically dispersed. So the purpose of Facebook is to share content, build communities and organise events. The two main ways that you might do this is by having a page or by having a group, and there are differences between them and they're for different purposes. So pages are more public facing. They can be thought of as similar to a website where it's kind of like your profile and you're communicating to your followers. Whereas groups tend to be private communities where people in the community communicate with each other. They can be public groups, but with rare disease communities, people tend to choose closed or secret groups to allow users to share information more confidentially and confidently as well. And the audience in groups tends to be more specific. specific. So for instance, you might have a group for patients alone, or even a subset of patients, so patients of a specific age group, whereas your page can be followed by anyone who's interested. And you can also add to your page a call to action and fundraising tools if you're a charity. So you'll see here on our Facebook page, we've got a little sign up button for our newsletter. That's the call to action that we've chosen, but you can choose donate and so on for your Facebook page. There are a few disadvantages to using Facebook. The first is the dreaded algorithm. I don't have too much time to go over this, but the basic premise is that Facebook shows the best content to more people. This is a win for Facebook because it brings people back to the platform, so they keep using it and they can sell more advertisements, essentially. Facebook determines the best content through its algorithm, which is taken from signals about your profile and about the posts that you make. So if you post and you regularly get a lot of likes and comments and shares, that signals to Facebook that you are a good profile to kind of be on there, and it will put your content on more people's news feeds, so more people will see it. It's also based on pictures, so Facebook likes it when you have a picture included, because pictures get better engagement as well. And it's also based on the words that you use. So if you use words such as sale, costs, and buy, Facebook doesn't really like that because they'd rather that you paid for an advertisement if you're trying to sell something. So it will automatically put that reach quite low down if you just use those words. Similarly, it doesn't like you forcing reach. So if you are telling people to like this and share this, it doesn't like that. It wants the reach not to be forced. So those are words to avoid as well. And you can find out a lot more about this online. There's loads of blogs saying how you can beat the algorithm and sort of certain words to avoid as well. Another thing to say on the algorithm is that last year Facebook changed how it runs the algorithm to favour posts by people as well, which is bad news for all of us in here if we have organisation pages, but that just means that you've got to really nail the posts that you are putting out there. A second disadvantage is that there's a declining use among young users.
So I'm a bit confused about this. So if you post something, it doesn't actually go to all the people who follow your page?
Not unless they can select to another level of follow where they do see everything, but unless they do that when they normally like your page, it doesn't. They'll just see what Facebook has determined to be the best content. So another disadvantage is declining use among young users. So last year, Facebook lost 2.8 million users under the age of 25 in the US alone. And that's because young people tend to be looking for the new trend and somewhere where they can escape from the embarrassing comments of their parents and grandparents. It's still growing among older generations, so it's still a good platform to use. But if you're particularly looking to engage young people, you might want to start looking elsewhere. That doesn't mean young people aren't on there, but it's sort of forward-thinking, you might want to start looking at other platforms that engage more young people. And thirdly, and this particularly applies to groups, it can be difficult to decide who is allowed in your group, on what terms, and how you control this. And Nicola will be talking about online communities later, and she might be covering some of this. So, on to Twitter. So, Twitter has a much smaller audience than Facebook, of 330 million monthly active users worldwide. It's got a large demographic range as well, in the same way that Facebook does, and it's a slightly younger audience overall. The purpose of Twitter is to get more of an instant newsfeed, and to allow users to get quick updates from organisations and people that they follow. There's a 280 character limit to sort of add to this instantness, which means that you have to capture your audience with snappy posts and good images. Twitter also allows communication between users, so you can tweet at people, you can reply to people's posts, you can tag people in things. For work purposes, Twitter is my personal favourite. It's more professional and news-focused than other platforms, and the concise posts that we are forced to post through the character limit means that we get a higher engagement overall than we do on Facebook. And I believe there's no algorithm on Twitter either. On Twitter, you can also use hashtags to put yourself into news streams to increase your visibility. But there are disadvantages to using Twitter, particularly in comparison to Facebook. So You cannot build a community group through Twitter like you can with Facebook. You cannot organise events, which you can do on Facebook. The shorter posts, while they're good because it forces you to be concise, it can be a time-consuming challenge. The number of the amount of time I spend trying to shorten down posts so that they fit into a Twitter post, it really does add up. And also people post more frequently because of these shorter posts, so it's kind of easier to get lost among all the kind of other media that's being put out there from other groups. Great, so on to Instagram. So Instagram has more users than Twitter, 800 million monthly active users, but still significantly less than Facebook. It's still a global audience, but it's skewed towards younger users, as you can see in this graph here. So if you want to target you specifically, this is a good place to think about being. The purpose is to share updates through images. So the image is the main point of the post, and then the caption, which you'll see here, is to provide more context and more information. So at FindACute, we use Instagram for a range of purposes. We use it to take part in awareness days. So see here we took part in Jeans for Jeans, even though if you look closely, you'll see our CEO forgot his jeans on Jeans for Jeans Day, so it's hiding. We also use it to give a shout out to our fundraisers. So this is a group that we took to the Cambridge Half Marathon. We also use it to share blog content from our website. So that was a post we did after a blog after our Working with Industry workshop last year. And then we also like to show the more personal side of the kind of FindACure team through Instagram. So sharing what we're getting up to in the office. This was Katie and Mary Rose preparing for our conference last month. And we can have maybe a bit more of a joke and kind of show the personal side of FindACure on Instagram. So on Instagram, in the captions, you can use hashtags as well to put your content into new streams, which is good. But unfortunately, you can't hyperlink URLs to other websites. So people can copy and paste. If you do put a link in the caption, copy and paste that link. But really, that's kind of a barrier, and people might not be sort of willing to do that. You can also put the link into your bio, so that's your profile on your actual page, and that does hyperlink, but you can only put realistically one link there at a time. And so it's really kind of time limited, and older posts won't have that link available in the bio. So that's something else to think about. That's what I said. So that's the second thing there. Disadvantages. Posts require a good photo. So unlike Facebook and Twitter, you can post without a photo, even though photos make it better. On Instagram, it requires a photo, and if it doesn't look good, people won't want to keep seeing it. They're less likely to follow you, and if they do follow you, they might unfollow you because they don't want sort of bad quality photos in their feed, unless they're engaging in other ways, perhaps the thing that you're showing through them. Captions aren't linked to URLs, what I just said. You're kind of, in a way, limited to a young audience. The older audience is growing on Instagram. This isn't a disadvantage if this is what you're trying to achieve through Instagram, but it's something to bear in mind if you're looking to engage just a wider audience in general. And like Twitter, you can't build a community, so you can't have a community group, and you also can't organise events on Instagram. Brilliant. So on social media, what do you actually post about? So it's different for each platform and purpose, but to just give some general ideas, you can post updates from your patient group, including your upcoming events and what's going on. You can share information and news about your rare disease, so your rare disease itself. And you can share more general news on rare diseases, healthcare, pharmaceuticals, politics, and a lot more. But where do you actually get this content? So first of all, you can make it yourself. So if you have a blog on your website, you can share this through your social media. If you have an upcoming event, you'll probably have a web page for that, and you can share what's going on with that event, how you're planning for it, how people can sign up. And another thing that we really like to use at Facebook is Canva. So you can use this to make images. It's free software to use, it's online, and you can see, so this is Canva here. You can make really nice, neat graphics really easily through it. Free to use for the basic version, and the premium version, charities can get for free as well. And it's really flexible, really nice to use, and you can download the images from Canva to use. So say if you want to make some infographics, this is a really good place to go. You can also find news using Google Alerts. So Google Alerts, you can see here, you type in some keywords into your kind of alerts profile. Mine are down here, they're a bit blurry so you can't really read them. But I have ones like rare diseases, health literacy and so on. And then once a day, Google will email me all the news related to those keywords in a kind of summary email. And then I'll have a flick through that email and pick out some good news stories to kind of share with our followers, and that grows engagement with our social media. And then finally, you can share existing content, so the sort of content that other users have put onto social media. And a good way to streamline this process is through hashtags and Twitter lists. And I'll show you how you can do that when I come on to my next slide. But just a couple of tips from me. When it comes to social media, I'd say keep it on brand. Keeping it on brand increases the recognisability of a brand, and also makes copying harder. So if you put a long time into an infographic, you might want it branded so that other people can't just take that. You also want to keep it professional. Really limit the use of abbreviations, hashtags and slang. Hashtags are good, but if every single word in a post is hashtags, it makes it really difficult to read. And I think it's really important to remember that if you want people to share and retweet your post, it has to be something that they're happy to be associated with. So they'll probably prefer to retweet something that reads well and actually shares interesting content. And then finally, keep it interesting. So you'll want to try and get a mixture of posts to meet all your audiences. Maybe share some facts about your rare disease, and then some general news, and then updates from your patient group, kind of all like jotted about, just to keep so that everyone who's following you is there for different reasons, keep them all interested. And then I would also say don't post just for the sake of posting. There's got to be a wider purpose to your post. What do the audience get out of it, and what do you get out of it? If you're just trying to fill slots and you're finding anything to kind of fill that slot, that will kind of break the virtuous circle where people are kind of liking you and following you, kind of, particularly the Facebook algorithm. Great. So there are lots of tools you can use to help you manage your social media, such as scheduling. And the scheduling tool we use at FindACure is called Hootsuite. So this is FindACure's dashboard. And here you can see we've got some scheduled posts for Twitter, so that I don't have to be there ready and waiting to tweet every time we want to tweet. I can just select a time for them to go out, and Hootsuite will do that for me. And you can add images through it, and you can also shorten URLs so that you don't get long, sort of messy-looking URLs in your tweets. We also here have it for Instagram. For LinkedIn, and that's another profile we use. I don't have time to go over it today, but if any of you are interested in getting on that, you can come and ask me in a break what LinkedIn is like. And then what I said before about getting content through hashtags and through Twitter lists. So this here is a stream that follows the hashtags rare disease, and orphan diseases. So anyone who uses that hashtag comes into my stream here, and I'll have a flick through and see if there's any interesting content a few times a day, and then I'll retweet things that I think our followers would also be interested in. And similarly, here is my Twitter list. So I've put together a list of all the rare disease patient groups that we follow, so lots of you will probably be in this list. Anything you tweet or retweet comes into my stream here, and I can then have a flip through and retweet the things that you post about, if I think they'll be interesting to our followers. Brilliant. So I'm running out of time, so I'll just try and sort of whiz through the rest. So I'm going to briefly mention analytics. This allows you to get to know your audience, and you can see which things would be most engaging. Facebook and Twitter have their own analytics service, so you can look and see which of your posts are performing best through it. You can also go into much more detail than this. So one of the platforms I like to use is Follower Wonk. This is free for Twitter, but you have to pay if you want to use it for Facebook or other platforms. And here you can see that we get really detailed insights into who our audience is. So we've got a map of where our followers are. We've got the time when our followers are online. We've got the words they use most commonly, and we've got their social authority. So how many followers our followers have. And there's so much more you can get from that service, Follower Wonk. So I'm going to very quickly go through my slides because I am running out of time. So everyone knows what a website is, but why are they important? They help to share information about your organisation and your rare disease, but actually to arrange this into a user journey. So when you're posting on social media, the things that you post will move down the page, and it won't always be there. Whereas on a website, you can kind of arrange it how you want people to see it, and it's much easier to find information. You can do a lot more than that. Websites are really flexible. You can add resources for patients, for families, for doctors. You can add an online donation form. You can embed surveys. You can look at getting user forums. And there's so much more that you can do with a website. Then it's called a World Wide Web for a reason. So anyone with the internet can access your website to learn about you. And they don't have to have a social media account to be able to do that when you've got a website. And visibility is another way for people to find you, what we said, through social media. However, as I'm sure you all know, it can be very expensive to develop a website professionally. There are a few pro bono web designs out there, and a couple that we've had that we've worked with previously are Creatives Without Borders and Pimp My Cause. You can also look and see if there are any local web developers to you who would help you do it for free or for cheap. It's always worth asking them. But you can also do it yourself, and there are some really good visual builders out there that are easy to use. You create your website using text and images rather than code. You can personalise it more with code, but they're really good as an easy way to kind of build a website. Wix, the first one in that list, is currently the best rated online. It's free for its most basic version, so you can even try it out for free, see how it works. But if you want more, you do have to pay, and it's between £2.55 and £15.57 a month. So it's still much cheaper than getting a website developed professionally. So website content and structure. You need to decide when you're making a website how you'll structure your content. And if you're stuck with this, we'd really recommend looking at similar organisations and how they structure their websites. You can take a look and sort of see if you can access their sitemap, and if not, kind of just map it out as you go through it. And you can write down what you like about their websites and what you dislike about their websites, and that will help you decide what you want yours to look like. I've got a few examples from some other rare disease groups there. And last year we ran a webinar on tips for your content for your websites. So if you head over to the YouTube link there, all these slides will be available afterwards, so don't worry about writing it down. You can have a look and see what we shared in our webinar specifically on website development last year. And similar to social media, you can also get analytics for your website. So you can access information on the number of uses, the average session duration, the bounce rate, how users find you, and so much more. It's free to use. And you can use this to improve the web experience that your users have. And this in turn is really important for search engine optimization. So just to briefly introduce that, it's similar to the Facebook algorithm in that when people search on Google, better websites will be put higher up the search list. So if you've got a good average session duration, for instance, that will show Google that your website is good, people enjoy being on there, and it will come higher up the Google search list when people search. Great, so very quickly go over e-newsletters. So e-newsletters are online bulletins sent periodically to groups of people associated with an organisation. But why are they important? So they're more direct, they're a really direct form of communications where your e-newsletter will arrive straight into their inboxes. Compared to printing and posting newsletters, it's also really cheap. And because you can hyperlink your e-news, It's easier for people who receive the newsletters to take action and say a printed leaflet or flyer that you send them in the post, because they can just click on the hyperlink and do it straight away, particularly if it's something, an action you want them to perform online. So the best platform that we found for e-newsletters is MailChimp. So it's free to its most basic level, and it's really easy to use. It's got drag and drop software, and you can use it to create a really professional and modern looking newsletter. You can see I was here, this was our one from last month, and you've all already joined our online communications workshop. Through MailChimp you can manage multiple mailing lists. So for instance, if you wanted to have separate lists for your patients, another for your fundraisers, another for your scientific community, to really tailor what you're communicating to them, and then you can manage that all through MailChimp, or you can have one for your whole community. It's up to you how you segment your mailing lists. But you do need to be careful of data protection regulation, which Susan will be talking about later this afternoon. So apologies for the kind of whirlwind tour. Thank you all for listening. I hope everyone picked up something new. And if there's anything that you want further clarification on, because I realise I kind of basically introduced certain things, but if you actually want to know how you use these things, how you can get signed up to them, I'm really happy to help. Come and find me in the break or in one of the sessions at the end.